Hello, my name is Dr. Dewan S. Raja. Today I will discuss about neuroendocrine tumor, also called carcinoid tumor. A carcinoid tumor is a type of slow-growing cancer that can arise in several parts of the body. It develops from hormone-producing cells of the body's neuroendocrine system. These tumors are most commonly found in the gastrointestinal tract such as appendix, also called vermiform appendix, the stomach, small intestine, colon or rectum, and the lungs, but they can occur in other areas like the pancreas, liver, or ovaries. So, what are the key features of carcinoid tumor? Slow growth. The tumor typically grows slowly compared to other cancers. Hormonal activity. Some carcinoid tumors secrete hormones, that is serotonin, histamine, prostaglandin, and also some type of peptides that can lead to systemic symptoms known as carcinoid syndrome. Asymptomatic early stages. Many carcinoid tumors do not cause symptoms in their early stages and are often discovered incidentally. So, what are the symptoms of carcinoid tumor? Localized symptoms depending on the tumor location. If it is large in the small intestine, it may block the GI tract. There may be intestinal obstruction and features of intestinal obstruction. We may have abdominal pain that may be due to serotonin effect and vasoconstriction effect of the neurotransmitters released from the carcinoid tumor, bowel obstruction, or bleeding from the gastrointestinal tract, cough, wheezing, or hemoptysis, that is coughing out of blood, lung, that may be related to the tumor in the lung or respiratory tract, flushing, redness, and warmth in the face and neck, diarrhea. Diarrhea may be hypermotility, or diarrhea may be niacin deficiency, the features of pellagra. Vitamin B3 deficiency happen in the pathogenesis of neuroendocrine tumor, carcinoid tumor. So there may be features of niacin deficiency like the three Ds, dementia, diarrhea, dermatitis, and one more D, that is the death. Okay, that may also happen. Heart valvulation is also possible. So from hepatic metastasis, the serotonin will go to the hepatic vein, then to the inferior vena cava, then it may damage the tricuspid valve or the pulmonary valve. Or from the lung area, if there's a tumor there, it may return to the heart, left atrium, so mitral valve may be also affected, depending on the type of pathology. There may be valve lesion in this way, caused by release of hormone, particularly serotonin, into the bloodstream, often when the tumor has metastasized to the liver. We'll get the syndrome of neuroendocrine tumor or carcinoid syndrome. Liver cannot handle such a large amount of serotonin and other like histacin, prostaglandin. Liver cannot handle, cannot metabolize them all in the late stages. Okay. So if we look at the carcinoid syndrome here, we'll find out that here the carcinoid syndrome, neuroendocrine tumor of the GI tract, causes hormone to flood the liver, going to liver through the portal circulation. Liver can break down the excess hormone made, so we'll get hormone in the blood that will cause the symptom. Hormone flood your body, causing carcinoid syndrome. like what? Flushing, jaundice, because it may go to the liver and may cause jaundice, damage to the hepatic cells, edema. There may be edema that may be related to heart failure or due to the as a whole low protein situation in the body, or kidney may be affected also, so there will be edema. Abdominal cramping and diarrhea, that is also a possibility because of the serotonin effect and the neurotransmitter causing vasoconstriction. So these are the features. Location of neuroendocrine tumor in many places, maybe in the lung, bronchi, stomach, pancreas, large intestine, small intestine, maybe in the jejunum, maybe in the ileum, appendix. It may happen in the appendix, maybe in the ovary or around the fallopian tube. That may be also possible. So, how to cope with Carcinoid syndrome? Maintain a healthy, high protein diet. Okay. Avoid alcohol and other triggering substance. Other triggering substance means tyramine rich food like that of old cheese or green cheese. Also, chocolate, spicy food, fatty meal, and food containing tyramine too much. One have to stop smoking, seek out support group, and reduce stress. Stress reduction may decrease the secretion of the neuroendocrine substances from the tumor. So diagnosis, for diagnosis, what we'll do? Diagnosis, CT scan, MRI, PET scans to locate the tumor, somatostatin receptor scintigraphy, octreoscan or DOTAT, PET for NET specific imaging, biochemical test, 24-hour urine test for 5-indolacetic acid, that is a serotonin breakdown product. This is very cheap and very sensitive. Blood test for chromogranin A, CGA, or serotonin level. Biopsy tissue sampling to confirm the diagnosis and assess the grade, low grade, intermediate, high grade. Okay, we got that. So these are the way to diagnose. EGA, 5-indolacetic acid, blood test for serotonin, blood test for chromogranin. We can do biopsy to confirm the diagnosis. We have also radiological tests like CT scan, MRI, PET. We may have also somatostatin receptor scintigraphy. So this is the biopsy, bronchial carcinoma, bronchial carcinoma growing in a spherical mass. This is that spherical mass. Okay. And the tumor mass into the lumen of the bronchi. Okay. The tumor cell have small, round, uniform nuclei, moderate amount of cytoplasm. These are the tumor cell in a high power field. Tumor cell. Okay. They have uniform nuclei and moderate amount of cytoplasm. Okay, we got that. This is from Robbins Cotton Kumar pathology. If we go to the GI tract, we'll see this is a tumor, neuroendocrine tumor, cross section of the submucosal tumor nodule. Microscopical nodule is composed of tumor cells embedded in dense fibrous tissue. Other areas, the tumor has spread extensively within the mucosal lymphatic channel. Okay, C, we got that. The C. If you go to the D, high magnification shows the characteristically bland cytology here. The chromatin texture with fine and coarse clumps is frequently described as a salt and pepper pattern. Despite their innocuous appearance, this tumor can be clinically aggressive. This electron microscopy reveals cytoplasmic dense core neurosecretory granule. These are the granules. okay, in electron microscopy. So treatment of carcinoid tumor, when it is a tumor, so we must remove it. We have symptom, we must give symptomatic treatment. Surgical removal, often the preferred option if the tumor is localized. Medication, somatostatin analogs. There is octreotide, lenalidomide to control symptoms and slow tumor growth. Niacin, because niacin cannot be synthesized. Okay, so we may have features of 3D, dementia, diarrhea, dermatitis, death. We can have 4D, and niacin is deficiency should be compensated by giving supplement of niacin. Targeted therapy like everolimus or peptide receptor radionuclide therapy PRRT. Chemotherapy for more aggressive or metastatic tumor. Liver-directed therapies if metastases occur in the liver. Then embolization or radioablation is an option. Prognosis, localized tumor often have a good prognosis with surgical treatment. Metastatic disease prognosis varies but can be managed with systemic therapies to control symptoms and progression. And that's all about the carcinoid tumor or neuroendocrine tumor. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.